Council, and also the chapter president for Gwinnett Gwinnett UAPRN. Want to get started. We got a lot to discuss. Juliana is going to come on and give us an update for legislative things. We got a lot of traction going on. So I'm going to go ahead and start until she joins us. And
I'm here. Can you hear me?
Oh, Juliana, great. Okay, great.
Yeah, yeah.
Juliana,
I couldn't.
okay.
I'm at the Capitol, so I couldn't get on with my computer. I'm having to call in because the session's still going on.
Okay, so I'm gonna let you go ahead and start, just in case you have to get off. Okay.
Okay. Yeah. We've been here all day, and the Senate's still going. As Regina said, I don't know when in all of our years of working together we've had this much going on at one time in one session, which is just really exciting, because we've got so many different nursing bills and so many different in both sides, the Senate and the House, and different postures right now. But to start with, we have the original bill, House Bill 215, that passed the House unanimously. Now it's over in the Senate. Okay, so it's sitting in the Senate Health and Human Services Committee because right now until after Monday, remember Monday's crossover. That's when by midnight on Monday, any bill for it to continue to be considered and live, what we say for the session, it must have passed at least the House or the Senate. So that bill is in good shape. It's sitting there in the Senate HHS committee. Okay, so but we won't touch. They won't touch it until after Monday. Now, in the meantime, we started a second bill, and that's the APRN license bill, the one that's in the 215. It does have the disability parking permit authorization also on it. But then we started a second bill in the Senate Bill 184. Now that bill, is it 184 or 186? I've got so many bills going in my mind right now. But it is, I'll look at it one second. It right now, that's the reason I'm sitting here. 164. Senate Bill 164. Please write that down. It passed out of the HHS committee, which was historical for us because remember that committee is chaired and vice chaired by physicians. And it passed out with no one voting against it. It was by voice vote. So that bill is now what we call in the Rules Committee. And tonight, when the Senate finishes, and we've had a lot of your leadership, and they've been reaching out to people all day long, reaching out to members of that Rules Committee, because they said they would meet later, so there's no telling what time it will be. It will be very late tonight. And they will select the bills that will go on the calendar for Monday for the Senate. So we are reaching out to all the senators on that committee and trying to get, because they actually go around and each senator on the committee, they alternate letting them choose a bill to go on the calendar. So we're desperately working to try to get that bill, that APRN bill, on the calendar in the Senate. It's called Senate Rules Calendar Monday. So they'll have pages of bills on Monday in the House and the Senate. So even if we get on there, then we've got to work all day on Monday into the wee hours of the night to try to get that bill pulled up and voted on. So that's the posture that we have right now. And a lot of you guys have sent sent text and emails to your senators to ask them, please help us. Please ask for that bill to be put on the calendar. I even reached out to my daughter's stepsister, who's an APRN in Carrollton, and asked her to and I helped her write a text and send it to Senator Matt Brass. He chairs that committee, asking them to please put that bill on. So that's the way it works. When we get to this point, you just got to reach out and ask as many senators as you can. So and tonight, when that's over, I'll be sending out a text to let you know if it got on. Okay, if it didn't get on, remember we still have that same bill or the same language already in the Senate. So we have, we have two opportunities there for our APRN licensure bill to move. Okay, in addition to that, we have another House bill that was introduced that we're working with the PAs on together. We're jointly with them, House Bill 557. Now, that bill is also in the House Rules Committee. It passed out of the House Public Health Committee this week, and it is our Schedule 2 bill authorizing APRNs and PAs to prescribe Schedule 2 emergency situation no more than a 5-day supply. It is limited for 18 years of age or older. You must have at least 1 year of experience before you be authorized to write the Schedule 2. So, but it is a step forward. It's not everything we wanted, but we will have at least get our foot in the door in prescribing for Schedule 2 if we can get this bill passed. It does make some changes. It has a few paragraphs too that impacts the protocol agreements to give some relief on how the protocol agreements are actually signed, and so it would make it easier for you in getting those protocol agreements approved through the medical composite board. So that bill is sitting there. So we'll be keeping you, and it's also in rules. So it's got to be chosen when the House meets for Monday. But it is signed by some key leaders, including the President Pro Tem, Jan Jones. So we're feeling cautiously optimistic that bill should be able to get on for Monday in the House. There are, unfortunately, our nurse anesthetists, who of course are APRNs, they have their own lobbyists because their issues are, quite unique compared to other types of APRNs. So they have some legislation. They introduced it in the House and the Senate, same bill. But unfortunately, we were there with them. We signed up supporting them to testify on their behalf in both those committee meetings, one in the Senate, one in the House, along with GNA and their lobby team. We've all been working together to try to help each other with all of these bills. But unfortunately, with the medical association, they kind of stood down on our APRN license bill. They did not come out openly against it, but they brought doctors and a host of doctors testifying against the nurse anesthetists, and so they were not able to get both those bills failed in committee. So they're not giving up. We're not sure what their strategy will be coming next, but we'll be following whatever they decide and supporting them in their efforts, because we were all very, very disappointed in the loss of those two committees. We also had a bill. We were really excited. The governor's leadership, with the governor's leader, they introduced a bill this week that actually is a bill that will help in relieving. I'm pulling it up. It's Senate Bill 246, and it will actually have student loan repayment with the Georgia Board of Healthcare Workforce. If a student agrees to, when they graduate, to work in nursing faculty at a university, they can actually get some of their student loan repaid. So this just got introduced. I've just sent it out, and I'll be sending out an update on all the different bills that we've been monitoring this weekend. And so look for that Senate Bill 246. It is a governor's bill, so there's a strong possibility that bill will pass. There's a number. We're also working the mental health parity bill. The second, we had the big mental health parity bill last year, 1013. They have the second version, which just expands on things that needed to be added and changed. And that is the bill that we were able to work to get for the Board of Nursing, to get the alternative discipline program inserted into that bill. And that the Board of Nursing was wanting us to work to help because they can't go out and, advocate separately. So we worked behind the scenes and we were able to get that language put into that bill that authorizes the Board of Nursing to offer an alternative discipline program. And the program was tailored after the program that the Medical Composite Board already has. And we're there are only 2 other states in the nation that do not have this type program in their nursing board. So that bill passed the full House today with that language in it. So we're so excited. Now it goes to the Senate, and we feel cautiously optimistic with it being passed in the House, and that it should remain in there in the Senate too. So that's really exciting. We've also been working in the governor's big budget that now the House has taken the governor's budget. They've worked on their budget, and that should be released Monday. We had asked for dollars to be put in that budget, again, on behalf of the nursing board, because that helps you, because of all of the delays that you are experiencing with the nursing board and getting either your license renewed or new license. We've been told that hopefully we've been successful in getting dollars added into the budget for 2 additional staff people for the Board of Nursing to help them, which will help the nurses in getting their applications, getting their nursing license renewed, and hopefully eliminate some of this very long wait time that we keep hearing about, and hopefully making their education person from a part-time person to a full-time person. That is what we asked for. We asked from the Secretary of State's office, and we went to appropriations, and we were told that hopefully that those dollars will be in the budget. So, but we'll know for sure on Monday, and then we'll have to work to keep it in when it gets into the Senate. But we worked, very hard on all of those items, and the alternative discipline program and the dollars in the budget for our nursing board, for our nurses in the state of Georgia. So that is some of the highlights. There are a lot of other good bills that impact healthcare that you'll be interested in seeing that have passed, at least that have passed, or either we hope to get passed on Monday. So look for that update when I send it, and it'll be a whole list of a lot of bills. And I'll have the link. I just have the brief description on each bill. But click on that link if you're interested in actually looking at the entirety of the bill. So we'll be needing your help over the next. If our bill makes it to the Senate calendar on Monday, and then also the Schedule 2. Then we'll be asking some of you to send emails to at least your own personal senator and representative, asking them to vote for our bills. So, but be looking for that, and Regina and Robin, along with Ashley and Michelle, and they'll be working with me over the weekend and getting ready for Monday. Some of them have even agreed to come down here and sit at the Capitol to kind of help us reach out and physically touch some of these legislators, because we'll probably be here till midnight on Monday. So, but be looking for your call to action to see how you can help us in sending out some emails between now and Monday during the day. Okay, and I'll be glad to answer any questions before I run off. I'm sitting here looking at the television. The Senate is still going on, but the minute they end, I've got to run upstairs for the Rules Committee meeting.
Okay. Does anybody have any questions for Juliana? Lisa Eichelberger, and you're muted. Let me get you off mute. Come on, sorry.
And Lisa has been our champion too, working on all this workforce data. She has just been relentless. For years, she's been working, and hopefully, I forgot to mention that bill too. Lisa, I'll let you share, because that was such good news when we what was put into the mental health bill that is relative to the workforce data. You share that, Lisa.
Okay, thank
Yeah.
you, Juliana. I wanted to ask if there is funding in the alternative discipline program. I know in the
Well-
mental health parity bill, it establishes that alternative discipline, but the composite medical board, the physicians have to pay for that alternative discipline program. It's quite expensive.
We haven't seen the budget yet. We were told by the authors of the mental health parity bill when they were presenting it, they said, now going along with this is just the main bill, but we're working with the appropriations at the same time because a lot of these recommendations in the bill will require funding. And we're working separately with the appropriations to get funding in. So, but we won't know what funding is in there until the budget comes out on Monday. So,
Okay.
but they do know, of course. I mean, it will cost money just even if the like in the medical association, the physician must pay the cost of going through the program, but it still is a lot of other costs and still administration of that program through
Right.
the medical board, and same way with the nursing board. But we'll be looking at that as soon as the budget comes out on Monday.
Right. And
But we
yes,
did mention that to them, that it did need a fiscal note with it. It would cost money.
right. And in that bill, there is a section, there actually are two bills that were identical, one in the Senate and then in the mental health parity bill. There's a section in there that would mandate the collection and reporting and analysis and reporting of health professions workforce data. It's demographic, and it lists demographic data and then where health professions are working. And it would have to be reported to the governor and the legislature every 6 months. If the bill passes, which looks like it will, because the one in the Senate was dropped by and sponsored by the governor's floor leaders. And that bill is on hold in the Senate because, the reason that the governor floor leader put it on hold is because the bill is identical in the House. And that's the one that passed the full House today. So this is very exciting because a lot of that information is already, in fact, more information was in House Bill 1013 that became law last year. And we're working with the Board of Nursing to revise the questionnaire that you'll be getting it when you renew your license right now. But this would establish a database that would report to the governor and the legislature every 6 months.
I know, dream come true for Lisa. She's worked on this for so many years. And
Yeah, 10
now,
years. 10 years, the GNLC Data Advisory Committee has been trying to get this data, and we just got data last week, 2 weeks ago, and it's still incomplete because people don't fill out the form, and until we mandate it, we're not going to get it. So.
Okay, we need this. Thank you, Lisa. Is there anybody else who have any questions for Juliana? Juliana, we thank you so much for all the hard work that you're putting forth. I mean, we are really behind you. Anytime you need some help, we'll hear you and we're working on it. Is there anybody else? Juliana, you okay?
Oh, yeah. One other bill, and I don't have the number, I don't have it at my fingertips right now, that, and I know that GNA was also working on this, and there is a bill too that's increasing some dollar amounts for preceptors. somewhat, not a lot, but somewhat. And but I'll send that. That will be in the list that I'm sending out. And then also the bill relative to the with healthcare workers, that are what am I trying to say? That are, if you injure or attack like a healthcare worker in a hospital right now, the penalties are enhanced for healthcare workers in the emergency room. And this bill would expand it to, all other healthcare workers, not just those in emergency room. But that last time I had looked, I have not had an opportunity to really follow that because so many other things are going on that I'm having to follow. It had not passed last time I looked, but hopefully we'll be able to get that out. But I know GNA is really following that bill too. I understand it started out of Piedmont Hospital was the one but I don't know all of the details of it. But that will be in my report when I send it. That way too, by then I should have an update. Because it takes them, they have to update whenever anything happens up here during the day. That's what I'm sitting here. They've got about 20 something people hand putting together bills and all. They do that every night and work for hours after the Capitol closes. They come in to get everything together and they have people updating. So by tomorrow, some of the activities that happened today will be updated. So I'll be able to see the status of all these bills tomorrow. So I will work on it this weekend and get it out to you as soon as possible. Well, I'm going to run so I can go. Hopefully they'll be through the bill soon. And like I said, keep your fingers crossed that we can get our bill on the rules calendar for Monday. Knowing we still got an alternative, we still have the other bill that's already sitting there, but it would certainly like to get this one through. And that way we have 2 shots at it before the end of the session. So I will let you know and let the leadership know. So, and thank all of you for coming on tonight. I apologize all the background noise and having to just call in by phone, but I will look forward and hopefully we'll have some good news next Thursday with our update after we have crossover. And call me anytime if you have any questions. Send me a text anyway, and then I'll call you back.
Thank you so much.
I'm going to sign off now so I can get down there and see how close we are to the Rules Committee meeting. Okay, thanks.
Thank you, Juliana. Ooh, we're moving and grooving. Moving right along, I want to let you all know that we met with Andrew Keller regarding our my brain is tired. I'm sorry about our computer, our program for EMP network, because obviously UAPRN, we have to get some more growth so we can get behind our legislators and move ahead. Our goal is to get full practice authority in the state of Georgia, get better health care for our residents, our people who live here. In order to do that, we must combine together. So Robin and I and Christina, we met with Andrew Keller, and he gave us some ideas on how we can work with our present computer that we have going, our present interface. My words are going bad, but anywho. Let me unmute Robin so I can get some help here. We lost a lot of members, UAPRN, and it may not be because we've lost them per se. They haven't gotten their message that we need to renew. And so we're working with the website to get that taken care of. It is so good. And on that website, we're putting in buttons so people can donate to our PAC, so people can donate to the lobbyists, because, all of this costs money. All this costs money. We have to take this back to our chapters. We provide these nice meals. We provide an excellent organization. And we were having excellent conferences. We have another conference coming down in Jekyll Island. All of that promotes our growth. And so because we are the advanced practice registered nurses for the state of Georgia, we have to grow and we have to work with each other. We have to work with all these chapters so that we can grow. Just like MAG is a big one, UAPRN has to be a big one. When people hear about UAPRN, they must know that we're the advanced practice work registered nurses. We're the strong arm hold for the advanced practice nurses in Georgia, and we are a good support team. So we have to be on the same page, and we are working hard to make sure all of that happens. And we have to give people like Juliana, Dana Hickman support. We are going to have our second legislative workshop on April 15th. Andrew Keller has agreed to be a part of that meeting so he can help us to learn how to use our webpage appropriately, how to get members. And then we're going to charge all these chapters to be in a membership drive, because we have to grow. We have to, our goal is to be 2,000 to 5,000 members of advanced practice registered nurses in Georgia. That's the goal. And we're working hard for it. Robin, you have something to say?
So just a couple of things to piggyback off you, Regina. So Andrew, we're still getting to our chapter questions that people have registered, but that they're having issues registering. If you know of anybody who is having difficulty registering, please let Regina and myself know. We'll forward that to Andrew. Also, there's a PAC button that we're adding that we're going to make active. It's very, very important, and there are going to be specific rules that are going to be posted with that, because we are a federal PAC, not a state PAC. And we're going to try to get that rectified and changed someday, but that is going to take dollars to do so for the legal help that we're going to need to do that. So in order to donate to our PAC, you have to be a member of UAPRN or a family member of UAPRN. So do you know that? Now, we are going to have a PAC challenge per chapter. That's going to come out here real soon. West Georgia, under Pam Shaw, has donated $500 to our PAC. Thank you, Pam. And we're going to start an initiative to challenge each chapter to match or beat it. So I'd like to do a little competition. I think that would be good for all of us. Oh gosh, Regina, what else did he say?
Well, people, we have to understand, and we have to educate our members in order. This is how the legislative process works. They rally for us, they advocate for us, and we want their support, but we have to support them too. That's how it's done. And I don't think a lot of people know. We also, go ahead.
So with that said, right, every year, it's a tradition, it's custom in politics. The week before our state legislators go into session, that first week of January, it's custom that every organization and their lobbyists present to their legislators their PAC contributions, their contributions to their campaign. And it was, honestly, I'm going to be honest, it was kind of embarrassing when Juliana and I went around, and Juliana would say, here's just a little contribution, not much, $250. But, the nurses do want to say thank you. So the counselors are giving out twice that much, if not more. So we have got to do better. This is politics, money talks. We just have to play the game. We have to support these legislators in their campaign. So that's why we're driving this campaign to increase our PAC funding.
Along with our donation for Juliana. The lobbyists, we have to pay her. She is on her game. I mean, she is a phenomenal lobbyist. She knows the ins and out down there at the Capitol, who's to talk to. Nothing in this world is free. We have to show her how much we appreciate her and by giving her our funds. Okay, so we need to make sure that we do that. I've said it before, I'll say it again. Every time I have a chapter meeting, and it's starting this month, we kind of pass the plate around a little bit to make sure that people who attend our events, that they donated. pass the plate, because our meals, the pharmaceutical reps give us, they pay about $135 per person. And I'm close a number for each member to come there. I mean, you're getting nice meals and so forth. And we're extending this out to people who become our members. Surely a $25 donation is not hard. We had Renee Unterman, who used to be our senator. She was our champion. She said if every nurse gave $10, how much that would be. But people don't understand the process. So our mission is to make sure people understand the process, join the bandwagon so that we can get some things done in the state of Georgia. Georgia is growing in leaps and bounds. We Robert and I they had the African American on the 28th, the legislators down there, and they were talking about how many jobs are coming to the state of Georgia. That's growth. With growth, we have to provide good health care, to the residents here, and the residents are coming, so if we're growing, we got the TV industry down here, the movie industry is down here. We got car industries coming down here. I mean, we are growing and we're going in leaps and bounds. We have to stay on top of it. And the only way we're going to do it is we got to bond together, and we got to let them know what we want, how we need to have it, and we got to play the game along with it. So we need you all to bring that back to your chapters. People, everybody knows more nurse practitioners. Bring them to the chapter meetings. Let's grow our organization. That's one of the initiatives that we're going to have. We're going to try to double our membership within the next 6 months. Okay, so we can get that taken care of. We want to sit there and educate and bring to the table what needs to be done. Okay, because it's got to be more than just Michelle, Juliana, Lisa, Igerberger. We got to give everybody, come on. We strengthen numbers, and we have to support each other. Okay, Robin?
So are we ready to move on to Board of Medicine?
Yes.
Okay. Another initiative that Regina and I are advocating for, we're just not advocating for the DRC for legislative issues, but for any issue that our UAPRNs across the state are facing challenges with. And it came to my attention as a practice owner that we were having difficulty with my own NPs getting their collaborative agreements processed through the Board of Medicine. Ashley Blackman, who cannot be on the call tonight, through her Facebook page, I was able to do a little survey and found out the extent of issues that were pretty compelling about ANPs who were applying for positions with hospital systems, but they had to be let go because their collaborative was not processed in a timely manner. You can't get a protocol agreement, you can't get credentials, you can't get a DEA number. So Juliana, Michelle, and I were able to get in front of the Board of Medicine and the governor's office last week. Daniel Dortz, executive director, we did request a letter from the Board of Medicine to explain to the APRNs across the state the issues they are having. I did receive that letter yesterday, and it's a very nice letter. It's a very direct letter discussing the issues that the Board of Nursing is having, or the Board of Medicine is having. It also reaches out with an offer to come educate across the state any of our chapters on how the Board of Medicine and protocol agreements work, which is something we asked for as well. So moving forward, Daniel and I are having weekly communication. Anybody that you know that is having a Board of Medicine protocol agreement issue, please email me, and I will forward that to Daniel. We're going through each issue one by one to make sure it's resolved in a timely manner. Now, I'm getting a lot of requests about the Board of Nursing with the APRN license. I don't have an exact answer for that yet, but I'll be working on that as well. Any questions about the Board of Medicine and the collab? I know it's a hot topic right now.
Does
I'm
anybody have
driving.
any questions? Okay. Okay. Shelly Ann is given, Shelly Ann, I'm unmuting you. You want to tell them about your event?
Oh, hi, everyone. Just wanted to say good night to everyone. Thanks for showing up. One of the things we want to make sure we do is get everyone involved. Can everyone hear me okay?
Yeah.
Get everyone involved with the initiatives and tracking the different bills and so on, and just getting involved and coming down when you can to the Capitol with us. Help for Healthcare Professionals is a nonprofit that I have here in Gwinnett County, and our sole focus is to mobilize people as well as community resources to reciprocate care for healthcare workers and first responders. So that's my sole focus. We started a couple years ago in the midst of COVID, and through our crisis relief education and advocacy efforts, we've been able to help a little over 21,000 healthcare workers and first responders. And we're happy to host our third event. We'll host a night of Glam and Gratitude on April 1st, honoring exceptional healthcare workers and first responders in and around the Atlanta area. So nominations actually close tomorrow. So feel free to nominate Nurse of the Year, Doctor of the Year, Public Health, Champion of the Year, Mental Health. We have a number of different categories, and I can drop the information in the chat, but tickets are on sale, and hope to see everyone coming out on April 1st to celebrate our colleagues and friends and, you know, those who are doing exceptional work in the community as well as at the bedside.
Also, what want to talk about? Does anybody have any questions regarding Shelly Ann's event? Okay, also we want to introduce, we got 2 subcommittees that will be starting. We're working on getting that subcommittee under the Gwinnett Forsyth chapter, and is talking about mental health. Lisa Walsh, she is joining us, and she is starting under our umbrella, so to speak. She is going to be bringing over a lot of mental health issues. I mean, United Mental Health and Substance Use Disorder for APRNs, and she's going to be bringing her group over. And this is a organization that works with mental health and how she's going to support the UAPRNs in that endeavor. So that's one. And Robin, do you want to talk about your subcommittee that's coming?
Sure. We're in the infancy stages. Christina Lamont she's secretary of the Atlanta chapter. She and I are both practice owners, and we have put a query out to see who else might be interested through, of course, Ashley's Facebook page and other social media entities who might be interested in getting together as nurse entrepreneurs. And we've gotten over 100 inquiries and people that are interested. We're just in the infancy. We're trying to figure out the best way to put out this platform. And we're probably going to do something like do some subgroups, aesthetics, internal medicine practice owners for functional medicine. We're still trying to figure it out. But if you're interested, please let me know.
So Yvonne Wolcott wanted to know, Robin, what did the letter say?
Okay. I am driving. I wish if I could pull over in a little bit, I can tell you. It's very lengthy. It explains a few of their issues, of course, labor shortages. It came about because we asked the Board of Medicine that we are APRNs across the state. We need to hear from you. We need to know. This has been going on for over 6 months. Nobody's answering our calls. We go to the board, knock on your doors, can't find anybody. We're being told that our collaboratives are sitting in stacks, still unalphabetized, and your protocol's probably in there somewhere. So we've lost a lot of faith and trust in the Board of Medicine. And so we asked the Board of Medicine to please address us. And this is what this letter is about. Very lengthy. I'm going to post it on the UAPRN website once I get Ashley's approval, and you'll be able to read it. And I'll post it to the Gwinnett chapter tonight, probably tonight or tomorrow.
Okay, Lisa Owsley wanted to make a message. Lisa, let me see if I can unmute you and you can talk about, I saw your question. I saw it. What happened? Let me see. Hold on a second. Okay, Lisa, I'm asking, go ahead, and you had a question, you had a statement to say. Lisa, you're unmuted.
Yes, can you hear me?
We hear you.
Okay, so it really wasn't a question. It was really supporting what you're saying, Regina. But what I've found as I am starting to travel to different chapters is that fundamentally, a lot of NPs don't understand fully the impact that we don't have our own license, especially our newer NP students. You know, I'm a professor and a clinician. So I just want to say that as someone that moved into Georgia 4 years ago and found out that we were the 50th state in health outcomes for our citizen, we're the lowest health. That makes this mandate, we don't have our own license. And I just wanted to support that. And I gave a shout out to a new commission report for people to review, to look at how we are so underserved in this state by primary care providers. Thanks, Regina.
Yes, Lisa, hopefully I've heard, I was listening to at the Capitol, hopefully, and that is on, it's under review. It passed the committee. So we're hoping that's one of the things that get passed down at the Capitol, that we get licensure so we can start breaking down some of these barriers. But you're absolutely right. But the only way that we're going to get this message out is we have to get educated. We got to start with our schools, because that's where they're training the new nurse practitioners, and we're going to try to reach out to the old so they understand not to be so complacent with what's going on with our healthcare in the state of Georgia. But you're absolutely right. But we're hoping that that bill passes and we will get licensure. Okay.
Yeah, that would be great. It's just really mandated. I also want to give a shout out to University of North Georgia. We have started the first UAPRN student chapter, and
Right.
it was a great success last month. So we are trying
That's
to,
great.
we recognize what you're saying, Regina, that our students must be educated as they are about the importance of being active politically and what these parameters mean, and this lack of access, having your own license, and having the ability to prescribe medications appropriately and practice to the full extent of our licensure. So thank you.
Okay, we're getting close. Does anybody have anything else that they want to bring to the attention of the group? Our next goal is to reach to all the chapters. We'd like to have at least representatives from every chapter on updated 8. So this was a good night. We had a participant of 33 people. Yay, 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 yay. And hopefully anytime you have any questions, you can definitely email me. Lisa, go ahead. I think, are you unmuted? Let me unmute you.
Thank
Lisa?
you. Thank you, Regina. Yes, I just wanted to introduce to those of you that may not know, I'm transitioning out of my role as co-lead of the Action Coalition, the GNLC, the Georgia Nursing Leadership Coalition. And Dr. Valencia Fleming is going to come behind me and alongside me. And she's here with us tonight. And so I just wanted to introduce, she's an advanced practice nurse herself and has a DNP. And so I just wanted to take this time to introduce to those of you that don't know her. But Valencia is here. And so I just wanted to let everybody know that she's going to, we're in the process of transitioning her into this role. And so I'm delighted to have her and delighted that she's here with us at Update at 8 tonight.
Valencia, I'm unmuting you, so hopefully you can talk to the group if you like. Well, I'm trying.
Hello, I got it. Thank you,
Okay.
Regina. Thank you so much, Dr. Eckelberger. Yes, I am glad to participate. I've been on this 8 at 8 even last year when you all were having them, so I'm not new to them, but I am new, as Lisa's saying, allowing her to train me for this new role. I look forward to working in this capacity. A lot of you all I have already met before, like Regina. I was at the last legislative update and met you and others. So I just look forward to working with everybody and pushing us forward in this state. So I think it's a wonderful thing and wonderful work of what everyone else has already done. And I just look forward to using that as a springboard to continue that work that's already been done. So over the last few years.
Yes, we're really excited to have her in this new role. So I just wanted to let everybody know that.
Thank you, Lisa. So our next workshop will be April 14th, April 15th, April 14th. Let me get my dates
15th.
right. 15th, and it's going to be at Northside Hospital. Dana has definitely reserved that spot for us. We're going to be sending out information for it. It's going to be at Northside Hospital, the one at Forsyth, 1200 Northside Forsyth Drive, Building 14. We will be posting this, and we would like for everybody to support us. We're already building our agenda for it. Gonna have Andrew Kellen, who's gonna come and help us to integrate EMP so we can get all our members back and grow some more and understand how to work with it, because it's an expensive software package that they put together, and it's already set in motion that we can connect with all the chapters. We're trying to get at least all the chapters to get engaged again. So we've got a lot of work to do, and we appreciate all the support that you all are giving us. This weekend, Robin and I'll be going to Columbus, Georgia. There's going to be UAPRN Columbus, their convention, their convention this weekend. So we look forward to bringing greetings from everybody to them. And Pam Shaw has done phenomenal work up there. Matter of fact, I was listening to the one of the representatives talking on the committee, and he was from her area, Columbus, Georgia, and he was advocating how the nurse practitioners need to have a licensure, because where he's at, they're far away from the mid city. Maybe the nurse practitioners in the city are not having challenges, but if you go further out to the places that are not so close, the nurse practitioners are having issues. Or I think he was talking about the Schedule II drugs, how he was advocating how they need to have access to that, because they don't have a lot of doctor support out there. So they are working very hard to have things done and get through. So we gotta keep up. Does anybody have anything else to say for this evening? We're about to wrap it up. Anybody?
There's something in the chat about accreditation and
Let me
hold
see.
on.
I see it. I can't see it.
3 schools in Florida lost accreditation
No, I can't
because of
talk about.
post-dating the students' graduation. Hold on.
Well, who's saying it, and I can unmute them and they can share it.
It's K.R. Groves.
Okay, I'm gonna unmute you, Kay, and you can give us that information, because this is all of our meeting. Okay, are you done? No, hold on. Okay, can you hear me?
Yes, I can. Can you hear
Okay.
me?
We hear you. Go. You got
Okay.
it.
I read an article yesterday about 3 schools in Florida, and they had graduated nursing students. They had lost their accreditation and in 2018 and backlogged some nursing students as saying they had graduated in 2016. They had taken the nursing board exam and they had passed it, but they hadn't gone to any classes. And so some of them had moved to various different states, one of them being Georgia. And then there was a lot of discussion about what a terrible thing this was, and they should be punished. And what was the Board of Nursing doing about this in various states? This is illegal. They made a comment that many of these nurses were licensed practical nurses. So now they were going to take their licenses away from them, but allow them to practice as licensed practical nurses. I was mortified. And the spin on it was, it was very inflammatory. So I didn't know if this, it sounded like it was just hard to make out what was really going on. But I wondered if anybody else had heard anything about this. This author said that they had attempted to contact the Georgia Board of Nursing I've tried to contact them before. They're sometimes hard to reach. And they had not gotten back with any comment in regards to this, but I would think that this could be a bad political PR issue for us, since some of them were from Georgia, and wondered if anybody had heard anything more about this other than me.
I have heard, I know for a fact GNA is working on it. It's an unfortunate situation when you know how hard it is for nursing schools. And I hated that some nurses got caught up into that for whatever reason. From my understanding, some of them have been practicing for a long time. So they may have gotten this craft down. We don't know what people have gone through, but I do know that they are working on it. I do not want us to get caught up in the paparazzi type talk chatter about people in our profession. It's an unfortunate thing, but I know GNA is working on it. I know I've heard of some nurses, they have gotten their license pulled, and I guess they got to figure out some stuff how to do it, but I don't know all the particulars, so I'm not going to make a judgment call on that, but I do feel bad that some people got caught up in that. I'm glad, and I'm not saying that they were right. They were wrong. We don't know what kind of conversation took place between the leaders who were doing that, because nobody comes on that on their own. Somebody else had to be a part of it. And I understand that the person around who's done that, they're making money. So they've really kind of took advantage of somebody in their poverty state. I hate it, but I don't want to make a judgment call on that because we don't know all the particulars of that. It's a sad thing.
Hey,
I agree.
Regina.
I just didn't know if the legislators were asking people, and if that has come to their attention, and if somebody were to ask you about it, do we have a response that we've crafted, kind of like what you just said? Because I do feel like this was really spun a certain way, and but it's so inflammatory right now with a lot of coverage on stuff. I was not sure what the legislators were saying.
Okay.
Asking.
So one of the comments that I can make, because I just lectured on this, Georgia and Florida made no legislative change during COVID. So we had 24 states that are full practice, then 7 states, and that include Georgia and Florida, made no legislative change during COVID. We had about 12 that made changes. They lifted their restrictions, but
Mhm.
Georgia and Florida did not. So our legislators did not respond to COVID. They did not change anything for us as far as our practice authority. And so I think that this is coming down because there was not a lift of any change for our practice. When you look at that information, it's quite interesting. I just introduced that in class Tuesday, that we were among 7, and Florida was one of them, and Georgia, of no lift of any sort during COVID. And all those other states either had full practice or they lifted restrictions for nurse practitioners so they could open access. But our state and Florida did not.
This is Lisa. I have sat through hours and hours of committee hearings.
Mhm.
And I have not heard any legislator refer to this issue. I have heard quite a few derogatory remarks made about the Board of Nursing, particularly with regard to the Schedule II debate. By a certain legislator about nurses and, you know, their propensity for drug use, and the board not, you know, maybe not monitoring them, and, you know, but she did not mention, and I thought at one point she would mention this issue because I've read about that. And there were 3 nurses that were practicing. One of them, I think, was practicing at the VA. But those nurses, you know, have perpetrated fraud. They obtained those licenses fraudulently, under false pretenses. And so they have been asked to surrender those licenses. I do know that I think 2 of them have retained legal counsel. And so they have to go through due process, amazingly. So I just text Tammy Bryant and Tara Taylor, the ED, the executive director, and to see if they have surrendered those licenses. And Tammy said she has not. They're meeting this week. Next week, and it probably will come up. But those are, I think, at the closed hearing. But nobody brought that. I have not heard one word said about that issue. So they may be discussing it, but I have not heard that brought up.
Well, that's good to know, Lisa. Thank you, because the article made the point that the nurses had been asked to surrender their licenses,
Right.
and none of them had done so.
Yeah, and they all paid $15,000 to,
Right.
yeah, they bought the license, and so it's very clear that they got it fraudulently. So, I mean, it's just a matter of time when they'll have to do it. But and they were fired. So, but it's shocking,
Mhm.
for those of us that have gone through that whole process of verifying people to sit for licensure, and but it is a process, and it does rely on the integrity. I mean, being a dean for so many years, you certify that person is of good moral character, and if the school doesn't verify that person, if the school is not doesn't have the integrity, that's where it breaks down.
Mhm.
Ma'am.
And so there is a faith process there. So it's very unfortunate.
Yeah. Agree.
Okay.
I haven't heard a word.
Well, we're
Thank you.
past time. It's 9:04. I want to thank everybody who participated in Updated 8. You'll be hearing from us some more. I thank you, everybody who contributed and made it kind of easy for me. And we're going to keep moving forward. We're going to keep moving forward, okay? You all have a good night, and you can always email me. I put my email in the chat, okay? And everybody knows how to get in touch with me. It's not hard, okay? I'm going to say good night. If everybody else is okay,
Good
Good night,
night.
everyone. Take care.
good night.
Bye, Regina. Bye, everyone.
Bye-bye.